Well, President Biden says he is not coming for your gas stove. The president reacting to news reports that left millions of people across America fuming, apparently misled after learning emissions from gas stoves make up more than 10% of childhood asthma cases. The U.S. Consumer Product Safety Commission ignited this conversation when one commissioner suggested regulatory action could be taken. But today on Twitter, the commission's chair extinguished those claims. So let's bring in Dr. Purvi Parikh, an immunologist at NYU Langone. Doctor, thank you so much for being with us. So the data shows that these stoves, they can release pollutants and carbon dioxide. But why do you think there's this focus on gas stoves specifically? Because there are other appliances that also run on natural gas, right?
Right. Yeah. And I think it's because of how commonly they're used. They're in almost 40% of U.S. households. Obviously, people have to eat, right? So they're used at least once a day, if not multiple times per day. And it's not even so much the carbon dioxide, but these stoves give off an even more dangerous pollutant or greenhouse gas called methane. And as that, as the stove stays on, that can turn into nitrogen oxide particles, then particularly nitrogen dioxide. And that's what's really harmful to people's cardiovascular health, respiratory health. That's actually what causes the inflammation inside the kid's lungs that is causing that uptick in childhood asthma. So that's where the concern is. And just like many things in healthcare, there are disparities, so lower income areas may have even more of these levels because of poor ventilation, older stoves. So there's a lot to take into account there.
And it is important information, obviously, to be aware of. We saw in that first graphic that was on the screen that nearly 40% of American households do have a gas stove. So as a physician, what is your take on them? Are they dangerous, or would you say that they're relatively safe? What is your ultimate take?
Right. I mean, with everything, it's the amount of exposure. What's key here is that ventilation does make a difference. And up until now, stoves aren't regulated to be ventilated so that the dangerous pollutants go out to the outside. So I know going forward, there's some discussion where they are going to improve the ventilation of the stoves, ventilation of the units. But like everything in medicine, it's very dose dependent. So the more you're exposed, of course, there is more risk of breathing in these dangerous chemicals. And again, if you have children, especially children who may have risk factors that predispose them to asthma, 10 to 13% is not a low number. So I think it's something that we do need to investigate and maybe upgrade these appliances and ventilation systems in homes.
All right, that's fair. You heard it right here. All right, Dr. Parikh, thank you so much for your time. Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.